Now the model because of that, so that's not to critique it, over-critique it, I tend to kind of favour a kind of an alternative way of beginning to look at outcomes. And I first saw it in Nottinghamshire in a learning disability contract. Though I think I would take it slightly differently, but let's just describe what Nottinghamshire have done. They went out to tender for community support to adults with learning disabilities. And they let 3 contracts to providers, and they said to those providers, we expect you to work with people with learning disabilities in the community, and we expect you to be working with them in such a way as you're helping those young adults develop more skills and become more independent, so that actually in the longer term you'll need less care. This included supported housing schemes, day centres, and a whole range of kind of domiciliary care support. And the way they managed that was the value of the contract went down by 3% every year. So the 3 companies who won the contract had a set sum in year 1, 3% less in year 2, and it was a 5-year contract. So it's gone down, it goes down quite significantly. I think we actually probably are in year 5 now, if I've got my years right. In the early days, the providers thought it was brilliant. There were easy pickings. There were so many people with learning disabilities who no one had ever done anything with, except let them languish in a day centre. But there was plenty of opportunity to help those people gain skills independence. People in supported living, reviewing their night staff arrangements, putting in telecare, and having cover arrangements. There were lots of scope for those providers. And if you were going to look, sorry, I should say, all of these providers were not for profit in terms of they were primarily voluntary or housing association run organisations. But they would say that there was a profit in the business in the first 2 or 3 years, and then of course it got tougher because the easy pickings had been had and they were then in a difficult frame. So you begin to see that actually, but they weren't kind of like looking at individuals, they were looking at the service. So it was kind of like slightly, there was just more emphasis on the provider improving the outcome for a set of people rather than for individuals. And the safeguard for the adults was that they all had social workers. So if somebody was being unreasonably exploited through the contract, that was the way their safeguard is. The other model I came across is actually, I live in Coventry, and a few decades ago I was the director of social services in Coventry, but I can claim no credit for this piece of work. I discovered that Coventry had decided to procure their reablement contract from their providers rather than carry on running it in-house. It obviously was intended to make a saving in the service. But what they did was, in the contracts, again, happens, it's a magic number 3, happened to be 3 providers who won the contracts across the city on a regional basis, on an area basis, so 3 different areas, 3 different providers providing the contracts. All 3 providers had previously been part of a wider range of about 15 providers who worked in the city. In fact, when the director, the current director, told me which the 3 providers were, it was of no surprise to me from what the 3 providers I would have picked 10 years earlier if somebody had told me, we're going to do this. If somebody had asked me privately, because you would never say this publicly, who are the best 3 providers in Coventry, these 3 would have been the ones that came straight out of my lips. So it's no surprise to see those 3 providers absolutely up for taking on this contract and offering reablement. The contract was clear. They had to take people from hospital, and they had to take people referred from social workers. And they were expected to ensure that 2/3 of the people, this figure will keep coming back to you, 2/3 of the people were re-abled, were actually helped in such a way that after the period of domiciliary care, they no longer needed any further help. A further group would need less help. And the contract was clear that that was the figure. There was no payment mechanism, no reward or loss if they didn't make the figure or if they did, but it was just the expectation of the contract. And I had supper with the director the other day, and he tells me still to this day, so that's been going for 4 years or so now, they still have that performance indicator. They've actually renewed the contract for the 3 of them. And 2 of the providers always outperform that indicator. One of the providers sometimes struggles to reach the target. That's okay. It becomes an issue for contract discussions, but it's nothing more than that. It's kind of there, it's in the culture, it's in what's expected, and it's no different than there should be an adequate workforce, or people should be paid a reasonable rate. Whatever else is written in the contract, that outcome measure is there, it's part of the discussion, and actually the 3 providers, they share, well, the council with the 3 providers share the data publicly between the 4 parties, the 3 providers and the council. So they all know how the others are doing, what's happening, and they have discussions about why does it not work in some places and not others. And there are good reasons for that, because sometimes you might have the best domiciliary care service, reablement-based service, that God herself would have designed. But actually you could end up with a social worker doing assessments at the end of it who's a bit risk averse and likes to give people a little bit of care. So actually that would affect the performance. Or you could have OTs and physios who aren't so clear and good at setting the plan for the rehabilitation and helping the care workers understand what has to happen. So there are other variables that impact on the performance, which is why it's not kind of like a pure science, but the culture's set. And across the city, after 4 years of the contract, across the city, 2/3 of people continue to be re-abled. And there aren't many places in the United Kingdom that can claim that degree of performance. There are a few. Kent, who have radically changed their model, actually probably can outperform that.